All right, so I'm here with my patient, Bonnie. She's a 26-year-old with two children. She's been having lower back pain in the L5 area for about 2 years. The stage of healing I'd say she's in is chronic non-inflammatory, just because she doesn't really have too much of that inflammatory response. I think thermal ultrasound will be good for her because I think her pain is coming from muscle spasm. So I think this thermal ultrasound is indicated to relax that muscle spasm and reduce her pain and increase kind of range of motion in that area. Contraindications are pregnancy for this patient specifically because it is in her lower back area, but she is not pregnant right now. You're not pregnant right now, are you?
Not anymore.
Okay. Lack of temperature sensation over reproductive organs, so we'll be over the thick muscle in her back, so we'll make sure not to be over her reproductive organs. What else? Malignant tumors. You don't have any malignant tumors, any history of that. And then blood clotting. Do you have a history of blood clotting? Okay. All right. So, Miss Bonnie, today, what I want to do with you before we do our physical therapy exercises, I want to do some therapeutic thermal ultrasound. So what this is going to do, this is going to help. So you have some muscle spasms back there that are really tight and causing you this pain, I believe.
Mm-hmm.
So I think that, which is really common with these spinal injuries that you're dealing with. So it will be a little hot, but obviously if you feel like stinging to where it feels like it's like burning the tissue and damaging the tissue, just let me know. We can stop or adjust. So how's that sound?
That sounds good.
All right, so it is on your lower back, so I will have you lay over on your stomach.
Okay.
And raise your shirt up for me.
Okay.
I'm gonna go grab a towel or two. Not good enough PTA. All right, so go ahead and get this set up. Is it okay if I tuck this towel kind of into your shorts? Good. Pull it down.
Yeah, go for it.
All right. All right. So right here is what we're looking for. These muscles.
That sounds good.
All right. Okay. All right. So I'm gonna turn the machine on. Well, first I'm gonna spread the gel out on you. All right. Just go ahead and spread the gel out. Might be a little bit cold. Alright, I'm going to go ahead and spread it out with the head here before I turn on the... Alright. So now I'm going to turn on the machine. Alright, before I turn on the machine, parameters I'm going to do are... Logan, can you hold this? So parameters I'm going to use are, we're going to go to click sound here, sound, and then since it's deep we're going to go 1 megahertz, thick lower back muscles, continuous for thermal. We're going to do about 8 minutes to get to that 1 unit mark, and that'll be a good amount of time for it. We're going to up the intensity to 1.5. Alright, so now before I start it, I'm gonna put the head back on here and we're gonna begin. and the ERA is 2 to 3 times. It's still not on yet. ERA is 2 to 3 times the head, area of the head here. So just make sure that that gets all the area we're trying to treat here. So, all right, I'm gonna put it on here, and we're gonna go for 8 minutes. All right. Just let me know if you feel any burning, anything like that. We can adjust. How's that feel?
Feels good.
Feel any heat?
A little bit, yeah.
Should relax those muscles in there and allow us to get some work in. Alright, so for the sake of the video, that's about 20 seconds, but we'd usually go for about 5 to 10 minutes. So I'm going to turn it off while I still have it on here. Alright, it's off. Take this off. Off. Alright. Go ahead and wipe the patient. Alright, wipe the head.
Felt good.
Alright, sir. And we are ready for your exercises.
Right.
There's no burning indication or anything like that.
Nope.
Alright. Thank you very much, sir or ma'am.